Are you or a loved one starting treatment with Wyost? This video will help you understand what Wyost is, how it works, and what you need to know to manage your health effectively. Stay informed and empowered on your treatment journey. Wyost, pronounced Wyost, is a medication known by its generic name, denosumab-bbdz. It's given as a subcutaneous injection, meaning it's injected just under your skin by a healthcare professional. Wyost belongs to a class of drugs called miscellaneous bone resorption inhibitors. This medication is an interchangeable biosimilar to XGEVA, denosumab. This means it's highly similar to XGEVA and has no clinically meaningful differences in safety, purity, and potency. Your pharmacy may substitute Wyost for XGEVA if prescribed. Wyost works by targeting a protein called RANKL, which is crucial for bone-resorbing cells called osteoclasts. By binding to RANKL, Wyost stops these cells from forming, functioning, and surviving. This action helps decrease bone breakdown and can increase bone mass and strength. This mechanism makes Wyost effective for several conditions. It helps prevent bone-related problems in patients with multiple myeloma or cancer that has spread to the bone. It also treats giant cell tumor of the bone and high calcium levels linked to cancer that haven't responded to other treatments. It's crucial to understand that if you receive Wyost, you should not also receive XGEVA or Prolia. All these medications contain the same active ingredient, denosumab. Taking them together could lead to an overdose or increased side effects. Serious allergic reactions, including life-threatening anaphylaxis, can occur with Wyost. If you experience shortness of breath, throat tightness, swelling, itching, or hives, seek emergency medical help immediately. Always inform your doctor about any known allergies before starting treatment. Wyost can cause severe low calcium levels in your blood, known as hypocalcemia. This risk is higher if you have poor kidney function or pre-existing low calcium. Your doctor will check your calcium levels before and during treatment, especially in the first few weeks. You may need to take calcium and vitamin D supplements to help prevent low calcium. Report any symptoms like muscle spasms, twitches, cramps, or numbness tingling around your mouth, fingers, or toes to your doctor right away. These could be signs of low calcium. A serious side effect called osteonecrosis of the jaw, ONJ, has been reported with denosumab products. This involves severe jawbone problems. Your doctor should perform a routine oral exam before you start Wyost. It's important to maintain excellent oral hygiene throughout your treatment. Avoid invasive dental procedures if possible, and always tell your dentist you are taking Wyost before any dental work. Discuss any risk factors like prior tooth extractions or poor oral hygiene with your doctor. Unusual thigh bone fractures, known as atypical femoral fractures, have occurred with denosumab products. Contact your doctor immediately if you develop new or unusual pain in your hip, groin, or thigh. This could be a sign of a fracture. Stopping Wyost treatment or even skipping or delaying doses can increase your risk of multiple vertebral fractures. If your doctor decides to stop Wyost, they will discuss transitioning you to another medication to help protect your bones. Do not stop, skip, or delay doses without talking to your doctor first. For patients with giant cell tumor of the bone or growing skeletons, high calcium levels, hypercalcemia, can occur after stopping Wyost. Your healthcare provider will monitor your calcium levels closely once treatment ends. They will treat any elevated levels appropriately to ensure your safety. Wyost can harm an unborn baby. If you are a female who can become pregnant, you must have a negative pregnancy test before starting treatment. You should also use effective birth control throughout treatment and for at least 5 months after your last dose. Tell your doctor immediately if you become pregnant. It is not known if Wyost passes into breast milk. You and your doctor should discuss the risks and benefits to decide whether to take Wyost or breastfeed. It is generally recommended not to do both. Before beginning Wyost, have an open conversation with your doctor about your complete medical history. Tell them about all your medical conditions, including any allergies to denosumab or if you are taking XGEVA or Prolia. Inform them if you have low blood calcium or cannot take daily calcium and vitamin D supplements. Mention any past surgeries, especially parathyroid, thyroid, or intestinal surgery, or if you have malabsorption syndrome. Discuss any kidney problems, dialysis, or a weak immune system. Also, tell your doctor about all medications you are taking, including over-the-counter drugs, vitamins, and herbal products, as some can lower blood calcium. Wyost is administered by a healthcare professional as an injection under your skin. The injection sites are typically the upper arm, upper thigh, or abdomen. The frequency of your injections depends on the condition being treated. For most conditions, Wyost is given once every 4 weeks. However, for some specific conditions, additional doses may be needed in the first month of treatment. Your healthcare provider will explain your specific dosing schedule. A typical dose for multiple myeloma and bone metastasis is 120 milligrams every 4 weeks. For giant cell tumor of the bone and hypercalcemia of malignancy, it's 120 milligrams every 4 weeks, with extra doses on days 8 and 15 of the first month. Calcium and vitamin D supplements are often necessary. If you miss a dose or an appointment for your Wyost injection, contact your doctor immediately for instructions. It's important to receive your missed injection as soon as possible to maintain treatment effectiveness. Do not delay or skip doses without medical advice. Like all medications, Wyost can cause side effects. Common side effects vary depending on the condition being treated. For bone metastasis, fatigue, low phosphate, and nausea are common. For multiple myeloma, diarrhea, nausea, low blood counts, back pain, and swelling are frequently reported. Patients treated for giant cell tumor of the bone may experience joint and back pain, headache, nausea, fatigue, and pain in the extremities. For hypercalcemia of malignancy, common side effects include nausea, shortness of breath, decreased appetite, headache, and swelling. This is not a complete list. Always report any new or worsening symptoms to your doctor. While on Wyost, it's important to follow your doctor's instructions regarding any restrictions on food, beverages, or activities. As mentioned, avoid invasive dental procedures if possible, and always practice good oral hygiene. Brush and floss regularly. Certain drugs may interact with Wyost. Avoid taking other denosumab products like XGEVA or Prolia. Also, discuss with your doctor if you are taking calcimimetic drugs, which can worsen hypocalcemia, or other drugs associated with ONJ, such as bisphosphonates, which may increase ONJ risk. Wyost should be stored in a refrigerator between 36 degrees Fahrenheit and 46 degrees Fahrenheit, 2 degrees Celsius to 8 degrees Celsius in its original carton to protect it from light. Do not freeze Wyost. Before administration, allow Wyost to come to room temperature for 15 to 30 minutes. Do not warm it in any other way. Wyost can be kept out of the refrigerator for up to 30 days at room temperature, up to 77 degrees Fahrenheit or 25 degrees Celsius in its original carton. Do not store it at temperatures above 77 degrees Fahrenheit or 25 degrees Celsius, as warm temperatures can affect its effectiveness. Do not vigorously shake the vial. Always keep Wyost out of the reach of children. Wyost is an interchangeable biosimilar. This means it is a biological product that is highly similar to an FDA-approved reference product XGEVA, with no clinically meaningful differences. Interchangeable biosimilars can be substituted by a pharmacist for the reference product without the prescriber's intervention, depending on state laws. This offers more treatment options and potentially lower costs while ensuring the same high standards of safety and effectiveness. Wyost provides an important alternative for patients needing denosumab treatment.